Distinguished guests, ladies and gentlemen, thank you for inviting me to join you during the official opening of the Nairobi Hospice and the launch of the first national palliative care policy document. I was deeply honored by this invitation because it falls during the week of World Hospice and Palliative Day, when the entire world is united in action to recognize, acknowledge, and appreciate the vital role of palliative care. This year's theme, Leave No One Behind, Equity in Access to Palliative Care, resonates with the aspirations of universal health coverage. It calls for equity in access and affordable care as a basic human right. Palliative care is recognized as a human right because of the rising burden of non-communicable diseases that have caused life-limiting illnesses to millions of people globally. It requires creation of systems and adaptation of how we deliver health care. Its primary aim is to give patients dignity, relieve pain and suffering, and provide love and comfort as they go through difficult seasons in their lives. We have all experienced pain, the pain families endure when loved ones have been diagnosed with chronic or life-threatening illnesses. Cancer, HIV/AIDS, cardiovascular diseases, dementia, and kidney failure are some of the diseases that require this care. It's for this reason that I congratulate and applaud the joint efforts of all stakeholders, led by the Ministry of Health, for the development of the first national palliative care policy. The spirit of this policy builds on the National Palliative Care Guidelines, along with other resolutions and declarations Kenya has adopted, which acknowledge palliative care as key to the health ecosystem. The National Palliative Care Policy that we launched today will go a long way in shaping how Kenya delivers this care. The new standards, guidelines, and protocols will determine how this care is integrated and implemented. Adequate application of resources and research will build a wealth of evidence of palliative models which may be applied in our country and through specialized training enhance the quality of service. Palliative care has transformed the quality of life of patients. We are aware that early detection and treatment saves families from enduring high costs of hospitalization. It eases the pressure of our sometimes overwhelmed hospitals. We have come a long way in how we view this type of care. Taboos, cultural and social barriers that were in the past associated with life-threatening diseases have been replaced by a more progressive and caring attitude. Over and above medical care, it provides emotional and spiritual nourishment. However, more needs to be done to increase awareness amongst policymakers, health professionals, and the public about palliative care and its benefits. All this is possible if we improve our advocacy and education on this subject so that we apply it at all stages of disease management, from early diagnosis rather than end-of-life treatment. Research has also presented strong evidence in positioning palliative care as a critical component of primary health care. In Kenya, we have not reached the threshold for access to palliative care due to the rising burden of non-communicable diseases. It's even more discouraging to note that these services are severely limited among children. For this reason, I urge that we find solutions that will accelerate the integration of palliative care across all levels. I believe that this policy will go a long way in identifying solutions and paving way for increased allocation of resources to establish more palliative and hospice centers. It will also provide the necessary template for provision of affordable medicine and treatment for managing symptoms. These solutions also require the recognition of community health workers for the crucial role that they play in the provision of care within the communities. I urge this cadre of health caregivers are incorporated into palliative care training in order to build their skills in supporting patients and families in home settings. So as we celebrate World Palliative and Hospice Week, we acknowledge the remarkable growth of palliative care services in Kenya. Hospices and palliative care institutions like the Nairobi Hospice, who we celebrate today, have provided over 30 years of service. I applaud the entire Nairobi Hospice team for the new facility we have opened today. You have been a beacon of hope to so many since you opened your door. We celebrate your impact, your commitment, your devotion. With those remarks, I declare the new Nairobi Hospice officially opened and the National Palliative Care Policy officially launched. Asante sana. God bless you all.